Swadika. Good morning, everyone. I am Dr. Arpornchayanon from the Department of Pharmacology, Chiang Mai University. So here I am today to present you all about the work that my colleagues and I have been doing in the field of traditional medicine and local plants that transform into contemporary pharmacological researches. Okay, here I am. First of all, I'm gonna introduce you about the department first. We have 3 research units in the department. First is the molecular unit. Second is the animal model unit. And the last one is the clinical study units. These 2 animal model unit and the clinical study units are the 2 units that we have been having for a really long time. Both units can produce the work that related to the other clinical pharmacology department. For example, clinical study unit also produce the work like pharmacodynamics, kinetics, and bioequivalence. But the molecular unit is the newest one that we are lucky enough to have high potential staff coming in. So therefore, in our department, we are able to perform the in vitro study, the in vivo study, and can proceed on the human study. Well, these are the picture of the laboratory units, especially my molecular unit and the animal model units. The things that we're going to talk about today is not concerning all the studies that have been doing in the department, but it's just going to be some of the works that related to the local plants and the traditional medicine. When we did the researching of these topics, we're focusing on looking forward to answer the question of how the local plants and traditional medicine works in its mechanism of action. Look for its clinical efficacy, and the last but not least, the toxicities of these agents. First, we're going to proceed on to the first unit, the molecular studies. Despite it is the brand new unit in the department, has been set up for a few years, but the head of the unit is able to publish some papers regarding to the molecular unit studies. First that I'm going to present is about something about the rhizoma, or in Thai it is called hem. They look at for the cytotoxic or anti-cancer properties on their head and neck cancer cell lines, which is derived from the oral metastatic squamous cell carcinoma. The result of this study about the cytotoxic effect from the hem, or in the name of Coccidium fenestratum. It is shown here when you give the crude extract of the CF at the higher concentration. The appearance of the metastatic cells change from polygonal appearance to round appearance as the concentration increases. That shows that there is the apoptosis or destruction of the cancer cells after being exposed to the CF extract. And the reason that is causing the apoptosis of these cells, we thought that it may be based on the alteration process on the signaling molecules, for example, on the P38, P53, and the Caspase-3 protein in the head and neck cancers. So if you have interested in this work and would like to discuss further, just go for her, Dr. Salanya Pin. She is the head of the molecular unit. Next, secondly, is the animal study unit. The animal study units, so these are the laboratories in the new building, the 50 years building on the 4th floor. In case you are interested and would like to take a look, we welcome all of you there. So we have basic study regarding to the local plants, for example, siam weed, or in Thai, ya sap sua. The staff look for its anti-gastric ulcer property in rat models. And tau in on extract, unfortunately, there is no English name, so I am unable to tell you what it actually is, but it's Thai plant. And the researcher tried to look for its anti-inflammatory and anti-nociceptive activity in rat and mice models. This one is very interesting because the researcher firstly established the animal model, and then after she get the result, she proceed on to the next step, which is the clinical study. So this study is something that we proudly present. And the newest one is the Drosophila smart model. This model has not yet been working, but we kind of settling the lab with the cooperation with the university in Japan and the other countries. Drosophila is the fruit flies. So the model is very intriguing and interesting. So probably in the next year, if I am going to represent in the conference again, I'm sure there's going to be something more about the Drosophila study. So, about the anti-ulcerogenic effect and the safety profile of the leaf that is extracted from the siam weed or Eupatorium odoratum. This is just only the examples from many gastric ulcers model. The simplest one is when we have a rat, we fasted them, and then we gave the tasted drug, either the control substance, omeprazole, or the extract of the Eupatorium odoratum. After that, we induce the ulcer by feeding the animals ethyl alcohol and hydrochloric acid. In the end, the animal was unfortunately sacrificed, and we cut the stomach open and look for the finding of the ulcer appearance. We could see that the extract of the Eupatorium odoratum gave the reduction of ulcer formation with similar level as omeprazole. So the Dr. Parirat, Dr. Natakan, and Dr. Phuongtip, they proceed on and look for the mechanism in another models, but it's not shown here. So they concluded that its anti-ulcer effect is based on the antioxidant property and the cytoprotective actions. So just ask her, she's sitting over there if you're interested in the work. So next, this is the work about the tau and on in animal model. Dr. Nattiya, the head of this project, she looked for the anti-nociceptive, the anti-pain, and anti-inflammatory activities of the Cryptolepis buchanani extract. For the first model, the anti-inflammatory activity, what she did was she measured the thickness of the ear or the pinna of the rat as baseline, get the baseline value, and then she induced the ear edema at the first place and measure, and then she applied the substance, for example, the control substance, the crude extract from the Cryptolepis, and then the indomethacin as the positive control. And after that, she measured the thickness of the rat's pinna, the ear, again, whether there is change. So the findings are shown here. For the extract and the indomethacin. As time goes by, there is the reduction of the pinna swelling or edema after application of these two things with similar outcome. This is Dr. Nattiya. If you are interested in, just go for her. So the last unit is the clinical study unit. Yes, I'm going to talk about some of the result about tau and on. After we get the primary result in the animal models, then she proceed on and make the application and use it in the patients who have been suffering from knee pain in osteoarthritis by spraying the oil formulation of tau and on to the patients. Another study is the shallot vapor inhalation. We look for the result after the patient have been inhaling the shallot vapor, whether it has some positive effect on nasal congestion in patients who have been suffering from common cold or acute rhinitis. And this is an interesting one as well. The lindsay mushroom extract has been searching for its action as prevention or control the symptoms from allergic rhinitis. So, in case you are interested, the efficacy of Cryptolepis buchanani extract as in oil formulation for the patients in osteoarthritis. So, when the patients are included in the study, they divided into two groups. The first group that have indomethacin, and the second group that received the spray of C. buchanani in oil formulation. They spray in at the different sites. And then the result, you will see that the pain is reduced. So in the end, at the fourth week after the treatment, the reduction of the pain is reduced at the comparable level in the group that received indomethacin spray and the extract spray. And this is how we do the shallot and steam inhalation in nasal congestion. For the score of the nasal patency perception, you will see that both groups that have steam inhalation and shallot inhalation, it seems like the patients feel that their noses has become more clear and can breathe easily. But interesting, when we did perform with the subjective investigation by using the rhinomanometry, the shallot vapor inhalation seemed to be increased the airway resistance. So we think that probably the feeling that the patient feel their nasal airway perception being better is caused by the destruction of the C fiber inside the nasal mucosa. So this idea is interesting for us. So we plan that perhaps we could go back to the animal model again to look for this mechanism and test the hypothesis. And this is the appearance of the linseed mushroom extract that becoming in the capsule. So we give it to the patient who have allergic rhinitis. And the placebo are going to be in the same appearance. Unfortunately, I cannot give you the result right now because it's not finished. The envelope is not yet open. So next year, perhaps, we could know the result. If you meet me or meet us again next year, just don't forget to ask. So, our future goal, we still would like to keep on transforming the local wisdom into scientific knowledge, conduct more and more in vitro, in vivo, and clinical researches. So, we look forward to working with all of you in the future. Thank you very much. ขอบคุณค่ะ